This is what we'll be doing today. And so we're going to start with palpations. And so we're going to start with the ulnar head. Palpate right here. And then we'll do the medial epicondyle, which is right in here. And then we'll go to the greater tubercle. So that's right here. And then we'll have him extend his arm a little bit. And then you can still feel it. And then he's going to come back. And it's right there. And then we'll do the AC joint, is where we'll be on the spine of the scapula. And then we're going to come down to the acromion process. And they're going to walk our fingers right to the joint, to the little dip in the groove. So you can feel it, and then you can move your arm around. And then you can feel a little motion in there. And then we're going to do the radial head. So now we have the lateral epicondyle, and then we'll go off of it. We'll have the radial head where you can pronate and supinate, so you can move your arm back and forth. This way. Yep. And then you can feel it moving underneath. And then we're going to do a sternoclavicular joint. So we'll be in here. And that's your jugular notch, so we have your sternoclavicular joint right in here. And then we're doing radiocarpal. So these are your carpal bones, and this is your radial. And then we'll just, right here, it's right in there. And then we have your sellar joint of your thumb. So we'll have it right here, and then it's right in here, and he can move his thumb around. And you can see it right in here. And then we'll have our second pip joint, which is the second finger. And then we'll do this right here, that's a pip joint. And then we'll do the scapular inferior angle. So we're gonna have him extend and then adduct. So you're gonna come back and then reach your other scapula, and it's gonna be right here. And then next we're gonna do our dermatomes. So first dermatome, we're gonna do T10, which is a umbilicus. So you're gonna lean back a little bit, just so I can feel. Close your eyes, and I'm gonna ask, does that feel the same?
Yes.
Does that feel the same?
Yes.
And does that feel the same?
Yes.
And then we're gonna do T12, and then we're gonna ask, does that feel the same?
Yes.
Does that feel the same?
Yes.
Does that feel the same?
Yes.
Okay. Then you can come back up, and we'll do C5, and I'm gonna do it on the same side, at both sides actually. And so C5, close your eyes again, sorry. And then we're gonna ask, does this feel the same?
Yes.
Does this feel the same?
Yes.
Does this feel the same?
Yes.
And then we're gonna do C6. So I'm gonna have him have his hands like that, and we're gonna do it, close your eyes again. And we'll have the dorsal web space right here, and then we're gonna push down, and then all those feel the same?
Yes.
Okay, and then we're gonna flip your hands back over. And then C7, does this feel the same?
Yes.
Does this feel the same?
Yes.
And does that feel the same?
Yes.
Okay. And then we're gonna do C8, so I'm gonna do the side, and we're gonna ask him, does this feel the same?
Yes.
Does this feel the same?
Yes.
Does this feel the same?
Yes.
Perfect. And now we're on to myotomes. So we're gonna do C7 first, and we're gonna have him come up, and then we're gonna have him extend his arm, and that's that. And then we're gonna have him flex his wrist. So just flex your wrist up. And then we're gonna have you have a fist, and then we're gonna have you extend your fingers. Good. So that was C7. Now we're doing C8 myotome, and that's when we're gonna have him flex his fingers. So he's gonna flex his fingers. So make a fist now, and you have a fist, and then you're gonna extend your thumb. Keep your hand up, and then you're gonna ulnar deviate your hand, which is gonna come inside. Good. And then for T1 myotomes, we're gonna do abduction and adduction. So he's gonna have it, and he's gonna go out. Good. And he's gonna stay out, and then I'm gonna have him come back in. Good. And we're doing that both sides as well. So you can come out, and then we'll do it again. And then we'll do a C7 too on this side. So you can extend, you can flex, and then again you can extend your fingers. And then we'll do C8 real quick, which is you'll flex these fingers. Good, make the fist, and then you'll extend your thumb, and then you're gonna ulnar deviate. Perfect. Okay, now we're going on to C7 reflex, which we're testing for the intactness of his radial nerve. So let me just get my testy tool out, and we're gonna go on the tendon right here, and just relax for me. Perfect. Sometimes you don't get a reflex, but that's okay. And then now we're gonna do peripheral nerve testing. So we're gonna start with the musculocutaneous. So we're gonna have him flex his arm up. So he's gonna do elbow flexion for me. Perfect, that's good. That's musculocutaneous, testing that. And then for testing radial, we're gonna have him come back up and we're gonna have him extend his arm. Good. And then for superior radial, we're gonna have him lay down on the table here, just lay down side. So for tensor fascia lata, we're gonna be doing slight flexion of the leg. You can bend this knee a little bit, slight flexion. And then we're gonna have an abduct, so bring it up. Perfect, and back down. And then for glute medius and glute minimus, we're gonna have a slight extension. And then we're gonna have an abduct. Perfect. And then we do those on the same sides. But you can come back up. And then for special test, we're gonna do the shoulder apprehension. So you're gonna go 90-90 for me. And then I'm gonna be pushing. This is testing. The shoulder apprehension test is testing for shoulder subluxation or dislocation. And then so I'll be pushing on the posterior side to anterior, and then keeping this externally rotated to see, and then you look at his face to see if there's any signs of discomfort, and then you can relax. And then we'll have our elbow valgus test next. So we'll be like this, and we're testing the stability of the UCL joint or the MCL. And then, so that's ulnar collateral ligament or medial collateral ligament. And then you push into medially and bring the forearm out while externally rotating it. That's good. And next we have the Allen test, which we're gonna do it on just one hand, but we do both hands. So what he's gonna do is he's gonna squeeze his fist 5 to 6 times and then hold it, and then I'll press the nerves. But we're testing the proper function of the radial ulnar nerves. You can let go of your fist, and it's white, and then we'll let go of the ulnar nerve, and it returns red. And then we're gonna relax a little bit, and he can go back into it. You squeeze again, and then clench, and then we're gonna press the nerves again, and then open your hand, and I'm gonna release the radial nerve. Good. And then next we're doing the Faber's test, so you can lie back down on your back. And so this is for sacroiliac joint pain. And so what we're gonna have him do is we're gonna have a figure 4 position. And then we're gonna press the ASIS and the knee. And then we'll do the other side. Perfect. And then we're pushing. That's good. You can come back up. Actually, lay back down. Sorry. And then we'll do manual muscle testing next, and we're on to elbow extension. So he'll have his arm all the way back. Bring this down like you're shooting. And then I'm going to stabilize the shoulder while he goes up. Good. And then go through a range of motion yourself, so just go up like that. Nice. And come back down. You're going to stay right here. I'm going to push you down. Good. And so you can come back up now. We'll do shoulder abduction manual muscle testing. And so just go like this for me and just raise your shoulder to the ceiling. Keep going. Good. And come back down a little bit. Rest right here and keep pushing up. I'm going to push down. Good. And then last one, we'll do wrist radial deviation. Actually, before we do that, we're gonna do the other side for abduction here. And then you're gonna come up, you're gonna watch the light. Perfect. And you're gonna come back down, and then you're gonna push up again. Perfect. And then can you lay back down real quick? I forgot to do the other side. And then for elbow extension, we'll have him go through the full range of motion again. Just going up all the way. Perfect. And then against some resistance. And then we'll have him stay and then push against me. Good. Thanks. And then you come back up, we'll do the wrist ulnar deviation. Radial deviation. Wrist radial deviation. So we're gonna have him on the table, just arm down like this. And then he's gonna radial deviate, so I'm gonna put pressure on it. Gonna push it in, and then he's gonna go through the range of motion himself. Good. And then he's gonna try to push. He's not gonna do it, and we'll do the other one. And then he's gonna go through the range of motion. Perfect. And then he's gonna go with some resistance. And then he's gonna do it again. Don't let me. Good. And that's it.